Neil Hamilton.
First Minister will be relieved to know I'm not going to ask him about the EU today, as I no wish to appear typecast. And and anyway, I had the opportunity to do so yesterday and will do later on today. I'd like to ask about the health service, in particular in relation to GPs. He'll know that GP numbers are broadly static, yet there's a rising demand for their services. In fact, in 2014, the latest figures for which I've been able to find, we have the lowest number of GPs in Wales per 1,000 people in the UK. 17% of GPs have sought guidance or advice for work-related stress in the last 2 years. 84% worry they may miss something serious in a patient due to workload pressures, and 56% plan to leave general practice or reduce hours in the next 5 years. Does he accept there's a growing crisis in morale amongst GPs in Wales?
GPs and indeed other health professionals who work in primary care at a level that we think is right and appropriate. For example, if you look at social care, we fund social care at 6% per head higher than England does, which is why we've not had the humanitarian crisis, to use the words of the Red Cross, that England has had within its NHS. We are also committed to recruiting additional GPs. We have more GPs in Wales than ever before, and that's why, of course, we have the recruitment campaign that was launched last year. I'm relieved he's not asking me about Europe, because he did appear at the press conference that was held yesterday with myself and the leader of Plaid Cymru as a member of the audience. I do thank him for the fact he is such a fan he cannot bear even to be away from the two of us even for a day.
Sometimes you can have too much of a good thing, but in the case of the First Minister, I'm happy to say that isn't so. Yeah, it's no answer to the question I posed. It's no answer to the question I posed a moment ago, that things are worse in England than they are in Wales. It is true that there is a pincer movement here of increasing demand on GPs, and with GP numbers not keeping pace with those rising demands. NHS funding on GPs in Wales as part of the Welsh Government's budget is down since 2004 from 10% of the total to 7.5%. The Royal College of General Practitioners say that more GP spending could actually save the NHS £90 million a year by 2020 if we reprioritise GPs within the Welsh Government's NHS budget. So is that something which the First Minister is prepared to consider?
Well, our £43 million primary care fund is supporting that with the emphasis on new and improved ways of delivering services. That involves delivering services and developing the services of nurses and pharmacists, physiotherapists and social workers to work alongside GPs. The answer lies not simply in increasing the number of GPs, it lies in ensuring that there are sufficient professionals available in a particular setting. We see it, for example, in Prestatyn, so that people can be referred to the appropriate professional rather than piling all the pressure onto GPs when people could go somewhere else.
Professionals will also know that in some areas of Wales, patient pressure, or in terms of numbers, on doctors' surgery sessions is now excessive. Can you give us any idea what he thinks is the maximum number of patients that a GP can reasonably deal with in a working day? And in particular, in relation to home visits for patients that are housebound, the Royal College of GPs tell me that in certain instances, people are having to wait up to 20 hours for a visit, which is clearly unacceptable. Some doctors are dealing with 120 patients per session instead of 50 or 60. Exactly how many does he think is reasonable for doctors to see in a session? And how does he expect the Welsh Government to meet its 6-hour target, which is currently being breached left, right and centre throughout the country?
It depends on the patients who come through the surgery on that particular day. For some people, they can be seen in 5 minutes. For other people, it takes longer. It depends on the nature of the patient. And GPs will have a good idea of the communities that they work in and the patients that they're seeing during the course of that day. But the point is, the last thing we want to do is to funnel more and more people towards GPs. We say to people, choose well. Go and see a pharmacist first. If not, then go and see a community nurse or a GP practice nurse. Then, and only then, is the GP somebody to go and see. There are issues of consistency of GP services across Wales, that much is true. Some offer broader services than others, they offer longer hours than others, and that's why it's so important to work with the Royal College and others to make sure that we see greater consistency in terms of service delivery.